My association with Dr. Veerabhadra sir has started in 1985. Sir used to come to our college to teach E.N.T for us. Then afterwards, as our families were closely related, Sir has invited me to join him. Sir used to work as E.N.T surgeon at Government General Hospital, Eluru then. So I and along with my friend, another friend, Dr. Prasad, we have joined him to do the internship as soon as we have finished the graduation in 85. And the association got continued till 86. Later on, as I got government job, I have left Sir in 86. So my entire association with Sir is only in E.N.T. At the time, we used to go to Eluru General Hospital for OP and IP to attend the OP and IP in the morning, and in the evening we used to go to Sir's own clinic over there in Eluru. So we had a lot of exposure of E.N.T for 1 year. Sir has encouraged us to give homeopathic medicines to E.N.T cases even at General Hospital OP and IP during those days of 80s. So my experience with him is confined to E.N.T practice only. So I will try to present my session as a tribute to Sir. Next, please. This one slide I would like to discuss, even though I'm getting late, because it's a tribute to my SVR sir, what I have learned from him in E.N.T practice, particularly diseases of nose. He has allowed me to verify these drugs on several patients, not one or two. Even government OP, Government General Hospital OP also, we have tried and tested them on many patients, and that is why I have titled like this, Clinical Efficacy. I tell you with my experience, we have proved the clinical efficacy of these drugs, particularly in nose, because this is a particular slide I would like to present today. Chucrium marum verum, everybody knows these things, but the things which point out the Chucrium marum verum are, first thing, crawling in nostrils. There will be crawling feeling in the nostrils for the child who is suffering with polypi, and there will be halitosis. As there are polypi in his nasal cavity, he will be having oral breathing. He'll be breathing through the mouth. His mouth will be open, which will bring this halitosis. Next, agraphis. Please believe me, I have treated several cases of agraphis without taking the help of surgery in my clinical practice, because I have that confidence, because Sir has given me many opportunities to test agraphis on several mucoid polypi cases. Agraphis will all have this mucoid polypi, grapes-like, there will be grape-like, there will be enlarged tonsils, impaired hearing, and throat with ear problems. Ear problems, nasal problems, which are causing hearing and throat problems, always go for agraphis nutans. Then lemna minor, the characteristic features of lemna minor, putrid smelling nose. Go to the near to the child, the nose will be smelling putrid. There will be dryness of nasopharynx. There will be another peculiar feature, pain like a string from nose to ear. And the lemna minor gets aggravated from damp conditions like dulcamera. Next, please. Next, please. Hippoxanum, another drug we have tried several times. The discharges of hippoxanum will be acrid, corroding, bloody. The nose will be swollen, red. I'll be finishing in 5 minutes, ma'am. Yeah. And there will be swollen glands all over. Then another important drug, arum triphyllum. You know this, constant picking and boring of large scabs will be there in arum triphyllum, which we commonly get through in practice, which we prescribe arum triphyllum for this. It affects mostly the right nostril. One thing that that remains constant in every aurum triflulinum case is there will be dryness and rawness of the nasal cavity. Dryness and rawness of the nasal cavity should be there if you have to prescribe aurum triflulinum. Calcarea fos, this is well known for adenoidal growths, anemic flabby children who are peevish. The one thing that catches calcarea fos is you will never miss it. The child always wants to move around. The child always, this is the mental general of calcarea fos. The child comes to your clinic, he will not sit in his place. He always want to move around. In the clinic, he'll be moving around. That is the mental general of calcarea fos. Next, please. I'll be coming to throat. I have presented only 1 or 2 slides because I know that the time will not be. These are the acute drugs for throat tonsillitis. I would like to pyrogenum. I think I can state this. I think because with my experience I can state this. I never failed a febrile case. I never failed by any febrile case in my private practice or government practice, febrile patient, a child patient with pustulations on the throat. You don't ask any question. Ask the child to open the mouth. If he has pustulations on his tonsils, and if there is temperature, first give him pyrogenum. I stick to my word and I am stating this on this dais. Next, within hours, the febrile state will be over. Then think of the tonsillitis. You can go for the other drugs. First, you have to bring down the temperature. And pyrogenum is well known for septic fevers. The same septic fever in tonsillitis, pyrogenum will never fail you. Then subacute. Subacute is, there will be problem, but the child will not be suffering because of his mental attitude or because of his immunity. He will not be expressing any problem. If you go into his throat, if you see into his throat, there will be this much tonsils. The subacute calcarea group, Beretta group, Silesia, sulfur. Chronic tendency of tonsillitis, Beretta, Silesia, calcarea fos, Lyco, hyperself. Indurations. This is one point. Tonsillitis, drugs for tonsillitis can be prescribed if they are indurated with not that much pain. Go for calcarea group, Beretta, MIR, MIF, Silesia, and Calibic. Next, please. Another drug, as confidently as I can tell with my experience, along with pyrogenum, is Calicarb. Most of us are missing. This is from herring. Chronic tonsillitis. Go for the homeopaths to try it. Maybe many of you have tried it, but I have to give my experience as this is a presentation of E.N.T. Please try Calicarb in chronic tonsillitis. If the tonsillitis is chronic, not repeated, chronic, with hardness of hearing, see here. Don't forget agraphis. Throat complaint, nasal complaints associated with ear complaints, deafness, agraphis. Pustules on tonsils, as I have told you, with fever, pyrogenum, without fever, right is MIF, left is MIR. Extreme sensitiveness to palpation and cold, heparsulf. Peritonsillar abscess, calcarea sulf.